But I want to bring in Vincent Variale. You know what, Vincent? Stand by for a moment. We're going to actually let this vehicle back out. Vincent Variale is the EMS lieutenant. He's also the president of the Uniformed EMS Officers Union here at the FDNY. And we should point out that Vincent also a presumed case of COVID-19 yourself. Looks like they're pulling back in, Vince. A presumed case of, they're not pulling back in. So this is what we've been seeing throughout the morning here, guys, by the way. The call comes in, that 911 call comes in, and these are the folks who rush out. In just a moment, we're going to talk about specifically the kinds of calls that they're getting. They're getting a lot of cardiac calls. In fact, Vincent, let's start there. Let's start with these cardiac calls that you guys have been getting. On Sunday, I understand it was an especially difficult day for you guys.
Yes, it was. What we're seeing is an increase in the cardiac arrest calls. Normally, we'd see about 80 calls throughout the city of New York. Now we're seeing a jump to 250 to 300 calls a day. So there's a lot of death, a lot of work for our members throughout the city.
My understanding is of those calls that you're getting, those cardiac arrest calls, some 75% of the people are dying as well. Usually that figure is far lower.
I'm sorry.
I'm sorry. Roughly 70% of the people, those cardiac calls on Sunday, they die.
Yes.
Do we know why that figure seems to be so much higher right now than usual?
Well, I definitely believe it's the coronavirus attacking the respiratory system in people. I had the coronavirus early on, and I can tell you it makes it very difficult to breathe. So especially if you have an underlying condition like asthma or respiratory problems, and you get this virus, you could go into respiratory arrest and then in cardiac arrest. So I definitely understand why the death rate would go higher.
Again, word coming down that we've 597 members of the FDNY have tested positive for COVID-19. You think that number is likely much higher? Why?
I think it's much higher. We still don't have adequate testing. We still don't have, from the very beginning, we've asked for testing, and FDNY doesn't provide testing. Our members are working 4 or 5 days a week, 16 hours a day, so they don't even have time to go get tested if they can find a site, and so it's still a problem.
You also said something to me before we came on the air that I had not considered. You've got a number of your guys and women as well who work a 16-hour shift, and at the end of that shift, to protect their loved ones, they're not going back inside that one-bedroom apartment.
That's correct. That's correct.
What are they doing?
So the FDNY has provided some lodging. Unfortunately, it's not enough that is available for our members. So many of them are choosing to stay in their cars after working 16 hours because they don't want to bring this home to their loved ones, to their wife, their children, their husbands. And many of them live in small apartments where they can't quarantine themselves from their families. So they are choosing to stay in their cars and for the night or at the end of their tour for 6 or 7 hours and then go back to work.
Normally, FDNY gets about 4,000 calls a day. What are you guys seeing right now?
We've seen the call volume rise as high as 7,200 calls. Last night, it was a little bit lower at 6,250 in the call volume, but it's still a 50% increase in the call volume we're used to seeing.
How are they holding up? How are you guys? How are they coping? How are they doing through all this?
It's tough, as you can imagine. A lot of them are physically, mentally, and emotionally drained. But, you know, we're dedicated, committed members to save lives, and they're all stepping up and working. We have a large percentage of the workforce, over 20%, that are still out sick. So, couple that with an increased call volume, it's tough on them.
We appreciate you. Vincent Variale, we appreciate the work that you guys are doing. Thank you.
Thank you.
Thank you so much. Do appreciate you, sir.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.